I rise in support of H.R. 7212, the Autism Collaboration and Accountability Research, Education, and Support Act, or the Autism CARES Act of 2024, led by Congressman Chris Smith. First, I'm grateful for all the work that has been done, the tremendous leadership of Representative Smith. He's been a fierce advocate and a leader on these issues for decades. Autism affects an estimated 1 in 36 children in the United States, with recent studies showing an increasing prevalence nationwide. Research has also shown that early intervention and therapies often lead to positive outcomes later on in life for individuals with autism. The Autism CARES Act of 2024 will reauthorize critical programs and activities that support autism research, services, training, and monitoring across the federal government. Importantly, it also takes steps to ensure the public and all individuals within the autism community have an opportunity to engage in and are included in the research process and other activities related to autism spectrum disorder. I appreciate the passionate engagement and support from stakeholders throughout this process, and I'm really grateful that we're considering this bill on the floor tonight before the program's September 30th expiration. I encourage my colleagues to support the bill, and I reserve the balance of my time.
I would say we can see this as a very important piece of legislation dealing with autism spectrum disorder, and I would urge my colleagues to support it on both sides of the aisle. Yield back.
61 members of the House have co-sponsored it. It's a totally bipartisan piece of legislation. Anna Eshoo has not only as a co-sponsor, but very helpful when we did Autism CARES of 2019. So this builds on that and expands it and strengthens it going forward. So, and I also want to thank the staff. You know, we know so much of the great hard work, the spade work is done by the staff, Molly Brimmer, Kristen Fritsch, Caitlin Wilson. I also want to thank John McDonough on my staff. I thought John would be here. He'll be here in a moment. And Scott Badich, who worked for Autism Society, who is now on our staff for a dozen years, and also for the United Way. Just a great collaboration of great people, all on behalf of helping those on the spectrum, those with severe autism, and of course, the family members and friends who have such a heavy, heavy lift in caring for and loving because there are so many challenges. Autism spectrum disorder, Mr. Speaker, is a neurodevelopmental condition characterized by persistent impairments in social communication and social interaction, as well as restricted and repetitive patterns of behavior, leading to difficulty in developing, maintaining, and understanding relationships with others. Frequently, if that's not enough, frequently accompanying autism are other co-occurring medical, behavioral, or mental health conditions, including gastrointestinal disorders, learning challenges, sleep disorders, feeding and eating issues, mental health challenges such as depression and anxiety, and sensory sensitivities that can lead to seizures. In some cases, certain symptoms are co-occurring conditions that result in self-injurious behaviors that present complex challenges to parents and caregivers. I'd point out for the record, Mr. Speaker, about 30 years ago, Bobby and Billy Gallagher, parents of 2 children with autism, who were babies at the time, came into my office in Whiting, New Jersey and said, we need to do something. Nothing's really being done. And sure enough, we found out that CDC was spending about $287,000 a year for their entire program, straight line for 5 years. I introduced legislation. Energy and Commerce Committee incorporated into the Children's Health Act, and that began this important rise in focus and providing the necessary resources to help those with autism to try to find a way of mitigating its impact on both the person with it as well as upon the family. The Autism CARES Act is a comprehensive reauthorization and strengthening of the whole of government effort that we have been working on now for 3 decades. We wouldn't be here tonight as well if it wasn't for the organizations. You know, several of them, we all know them, Autism Speaks, the Association of University of Centers on Disabilities, the ARC of the United States, Profound Autism Alliance, and Autism Society, among many others, who provided us useful and very informed thoughts and suggestions that are incorporated into this bill. For the last 2 years, we've been meeting with them, again, trying to find what needs to be done, where there's overlap. We don't want to repeat things that don't need to be done. And one of the things I've learned so much about how well this is working under IAC, which is the Interagency Coordinating Committee, is they go overboard trying to prevent duplicative research, so that we're not just spending money, we're trying to do it in a way that is very, very precise, and very focused. As the chairwoman a moment ago said, 1 in 36 children in the United States are on the spectrum. In my state, it's 1 in 35. So we're one of the top 3 in the country that have manifestations of autism. So we need to do more on this. The bill does also include the whole idea of the entirety of the age. No matter what age you are, if you have autism, we want to help you and provide the necessary resources. And we started that in the last time, and it is making a difference. As my friend from New Jersey pointed out, it increases from 5 to 7, the NIH Centers of Excellence, and it just does so much in every category to try to, again, help those. Let me just remind my colleagues, and I'll finish with this, that we now have the capability to detect autism as early as 18 months. Incredible developments have been made in this area, yet the median age of diagnosis in the United States is not until 4 years of age. So we're missing crucial early intervention opportunities by not identifying and then helping those who have it. So I urge passage.
Mr. Speaker, I rise today in strong support of H.R. 7213, the Autism CARES Act of 2024, which reauthorizes and strengthens the Autism Spectrum Disorder Initiative through 2029. The Autism CARES Act is the single most important driver of federal investment in autism research and training programs over the past 2 decades. It has led to improvements in early intervention services, a better understanding of the prevalence of autism, and a better understanding of the co-occurring health conditions that autistic people experience. Importantly, it has also been responsible for thousands of future health professionals being trained on how to screen, diagnose, and provide interventions to autistic people and other individuals with neurodevelopment disabilities to improve their health and well-being. Thanks to the Autism CARES Act, many health professionals are better equipped to meet the ever-changing and diverse needs of autistic people and other people with neurodevelopmental disabilities. This bill will ensure ongoing support by NIH of research at institutions like the Marcus Autism Center in Atlanta and the Georgia Lynn program at Georgia State University. Located in my home state of Georgia within Children's Healthcare of Atlanta, the Marcus Autism Center is one of the largest organizations in the country that blends research on autism with providing clinical services for children on the autism spectrum and their families. I'd like to thank Representative Chris Smith for working on this important issue, and I urge my colleagues to support this legislation. Thank you, Mr. Speaker.
The Autism CARES Act has made an immeasurable difference in the lives of countless Americans living with either autism, neurodivergence themselves, or the family members that support them. The massive investment made by this federal government in research, education, and intervention has not only ensured great advancement in how we both diagnose and treat and assist those living on the autism spectrum, but it's helped to bring dignity to their lives. I join my colleagues in advocating for the bill, certainly support the legislation. I do so as a member of Congress, but I also do so as a father of an adult living on the autism spectrum. I cannot tell you the struggle, the challenge that families like ours and certainly individuals like my daughter have had to face. Thanks to the Autism CARES Act, originally adopted some years ago, now reauthorized, every step along the way, we now have a partner in providing and ensuring that those caregivers, those who interact, those who provide care, have the tools and the resources necessary to provide dignity and opportunity to her life. And so on behalf of my daughter, Abigail Faith Molinaro, I join my colleagues on both sides of the aisle and encourage support for the Autism CARES Act reauthorization.
Mr. Speaker, I rise in support of H.R. 7213, the bicameral bipartisan bill to reauthorize the Autism CARES Act, which is sponsored by my colleague from New Jersey, Chris Smith. The Autism CARES Act, formerly known as the Combating Autism Act, is the primary source of federal funding for autism research, services, training, and monitoring. Since 2006, this law has paved the way for incredible scientific developments. Research funded by the law has advanced diagnosis in young children 18 to 24 months of age and has helped identify timely interventions to make a lifetime difference in the care and treatment of individuals with autism spectrum disorder. Another significant example of the Act's success is the Leadership Education in Neurodevelopmental and Other Related Disabilities, or LEND program. And this program has trained nearly 22,000 interdisciplinary health professionals in autism screening and identification benchmarks to improve diagnosis and care. These programs collectively provide diagnostic services to confirm or rule out autism or developmental disabilities to over 115,000 children. In my home state of New Jersey, the prevalence of autism remains alarmingly high as the incidence of autism continues to grow nationally. And we're fortunate to have Rutgers University as the home of New Jersey's Autism Center for Excellence, leading the way on several important issues to the New Jersey autism community, including highlighting disparities in getting diagnosis, providing service programs aimed at adults with autism spectrum disorder, and improving the lives of people who are living with this disorder. And progress has been made, but our work is far from over, and we must continue supporting children, families, and caregivers throughout their lives. So I'm pleased that through our bicameral, bipartisan negotiations, we're able to increase the number of NIH centers of excellence from 5 to 7. We were also able to come to agreement on requiring more updated reporting from the Department of Health and Human Services on mental health needs among autism patients. This will help provide better research and support for children transitioning to adulthood with autism, and providing a technical assistance center to ensure evidence-based communication tools are available to patients with speech pathology or audiology challenges. Now, I must say that I am disappointed that the current speaker's protocol prevents us from providing the robust funding necessary to meet the implementing agency's projections for this law's 5-year reauthorization period. I feel the bicameral bipartisan compromise before us is a strong product, and I urge my colleagues to support it.